Hello, I'm Ricardo Muñoz, Professor of Clinical Psychology at Palo Alto University and Professor Emeritus at the University of California, San Francisco. I would like to thank Katarina Barkman for having invited me to make a few brief remarks for the October 2019 conference of Sweden's Forum for Health Policy. I will share three recent events that may be relevant to your work. First, on September 11, 2019, the U.S. National Academies of Science, Engineering, and Medicine released its third consensus report on the prevention of mental disorders and the promotion of mental health. The 310-page report is available to download at no charge from the website of the National Academies Press. Its title is Fostering Healthy Mental, Emotional, and Behavioral Development in Children and Youth. The two earlier reports, published in 1994 and 2009, are similarly available online. The 1994 report defined prevention as interventions that are administered before the onset of a clinical episode, such as before the onset of a major depressive episode. The 2009 report called for the mental health system to begin implementing the evidence-based preventive interventions that were then available. Both reports pointed out that treatment is not enough. Prevention can reduce human suffering and avert the major sequelae of full-blown clinical episodes. Both reports also define mental health promotion interventions as focused on healthy development rather than on preventing specific mental disorders. The 2019 report encourages the field to scale up prevention and promotion interventions, but it also points out that to have impact at the population level, we need to expand our work beyond individually focused interventions and implement interventions that focus on the family, the community, and social policies. The second event is related to scaling up interventions so we can reach as many people as possible. In 2018, members of a think tank of the Association for Behavioral and Cognitive Therapies published an article in the journal mHealth titled Digital Apothecaries, a vision for making healthcare interventions accessible worldwide. Digital apothecaries are online repositories of evidence-based health interventions such as websites and apps. We refer to these interventions as massive open online interventions, or MOOIs, M-O-O-I, because they are similar to massive open online courses, or MOOCs. Like MOOCs, these massive open online interventions would be open at no charge to anyone who chooses to use them. They could be developed to address many health conditions in many languages. Digital interventions are not consumable. Face-to-face interventions and pharmacological interventions are consumable. That is, they are used up when they are administered. At the end of a cognitive behavioral therapy session, that hour can never again benefit any other patient. Similarly, a nicotine patch, for example, has to be discarded at the end of the day. Digital interventions can be used again and again without losing their therapeutic power. And they can be used anytime, anywhere, rather than requiring a user to have to attend a session at a particular time and place. The marginal cost of digital interventions goes down the more people who use them. If a website costs $1 million to construct and to test, and 1,000 people use it, each person costs $1,000 to use. But if 100,000 people use it, then the cost per person is only $10. And if 1 million people use it, the cost per person is $1. This means we can share massive open online interventions with large numbers of people at little extra cost. We cannot do that with face-to-face interventions or medications. The third event is the release of the U.S. Preventive Services Task Force recommendations on preventing perinatal depression. Published in the journal JAMA, the Journal of the American Medical Association, on February 12, 2019, the task force reported that there was now sufficient research evidence to show that the onset of major depressive episodes could be prevented during pregnancy and postpartum. It listed several interventions based on interpersonal therapy or cognitive behavioral methods, such as the mother's and baby scores, which have been found to significantly reduce the number of new episodes in women at risk. Given the major impact of depression on the mother herself, as well as on the baby, the task force recommended that these preventive interventions be offered routinely in prenatal clinics. I wanted to share these events with members of the Forum for Health Policy because they reinforce the work that you have already been doing in Sweden. Your group is already involved in innovative initiatives to promote, prevent, and treat mental, emotional, and behavioral disorders. You routinely consider social policy issues that will affect the health of the population of Sweden. These three events provide additional support for your work. Specifically, the National Academies reports summarize numerous studies that demonstrate that specific mental disorders can be prevented and that there are methods to promote healthy development. The article on digital apothecaries provides a method to help as many people as possible. And the U.S. Preventive Services Task Force suggests a specific initiative to prioritize in terms of healthcare policy. If we prevented perinatal depression across the nation, we would create a generational cohort of children with lower risk for depression and other problems. If Sweden could document this impact, it could serve as a beacon to the rest of the world. And it would take a major step on the road to a world without depression. Thank you.